You're live.
Hi everyone, it's Danielle with Dr. Emer's office. So we are doing some TCA Cross and Fractora today. It's a really great combination, something that's going to not only tighten the skin and improve a variety of different types of scars, but we're pairing it with TCA, which is great for ice pick scars. So we deliver TCA, which is a very strong acid, with this tiny little toothpick. And the reason is because we want to be very precise in where we're placing this acid. So if you look at these areas, go ahead and turn this way. These tiny little ice pick scars have developed what's called frosting. So what's going to happen is that this white frost is going to turn into a scab over the next day or two, and after anywhere from 4 to 7 or 8 days, the scab is going to dry, flake off, and then it'll heal itself. And what it does in theory is that the edges of the scab are going to shrink the skin inward and close up that little scar. So now this is not a one-time treatment. It will take multiple, but all these little spots kind of look like enlarged pores, and they're visible under makeup, and it's really hard to hide them. So the best thing to do is to shrink them down, and that is exactly what TCA does. So go ahead and turn your head to the side. So our patient primarily has acne acne scarring around the temples, her cheek, and a little bit right in here by her nasolabial. The temples are a very common place to get acne scarring such as this. And so we're gonna go through and just touch each of these spots with the toothpick. And at first it doesn't look like much is happening, but once you've given it a few seconds, the frost will develop. And so for some of them, on this side, the scars are a little bit more pronounced, but we're placing this acid right in the base of the scar. On the other side, they were much more pinpoint. And so sometimes when they're really small, we use a side light to really highlight the shadows. It helps us to find the ones that are not quite noticeable until you're in that right lighting. It's the dressing room lighting where it highlights all of your skin concerns. So we use that a little bit in office to really maximize each treatment. So we're gonna wait for that frost to develop and kind of check the other areas. Turn towards me, perfect. So I don't know if you can see, she's got a little bit of textural irregularity here. And that acid is going right into the base of the scar.
What does it feel like when you first apply the frost?
What's it feel like to you?
It really doesn't feel like anything, just like she's touching very lightly with a toothpick, so it's not bad at all.
Nice.
Typically, acids from chemical peels might feel like a little itchy.
It feels warm.
And you can see that response in the skin. She's getting a little, she's going to have some kind of redness from our topical numbing that we have for the Fractora, but her skin is developing redness in response to that kind of spicy heat sensation. It's like hot sauce, and it will develop that tingle, and that tingle is going to create redness. So you can see here it's really confined just to the areas that we've placed our TCA, so that heat is showing itself now. It's not painful.
Mm-mm.
Okay, so we're going to give that a second to continue to develop. And you just do, depending on the size of the scar, a couple coats till you develop a good frost. It doesn't require a lot. You have to be really patient with it. All of that looks really good. There's a few little techniques that are involved with TCA. You can feather out the edges when they're a little bit flatter. But for the most part, they're pinpoint, so that looks great. I'm gonna leave it right there and just double check the area. Looks good. Okay, so we're gonna move on to the second treatment, and this one's Fractora. Now, I love this radio frequency microneedling treatment. You'll be good, and if you need a break, you just tell me. Really, just tell me. We'll take a breather. We numb topically for it, but it can be pretty uncomfortable, especially over bony areas such as the forehead. So we're spot treating, so we'll get through it really quick. Great. So now, our needles here, this is our tip. It's a 24 pin tip, and the needles are coated. And so that silicone coating is going to prevent heat on that epidermal layer of skin. So it's going to minimize any chance of pigment production. That means that we have a far reduced incidence of adverse effects. It's safe for all skin types, good for active acne, acne scarring, and what it's really going to do and the change it's going to cause in the skin is tightening. And so tightening is going to make scars look better. I'm going to knock these out of the way first. So bear with me. First ones. You okay? So we're just going to get a couple of these guys out of the way. One more, okay? Good. So you can see, you okay?
Oh, thank you. I was like, what is that?
All right, head to the right, perfect. So we're gonna go down along the temple now. First one right here. Good. So with this treatment, you do wanna have a decent amount of pressure so that the prongs are in full contact with the skin. This is radio frequency through a device which essentially circulates the energy from the top to the bottom of the skin. And so you want to make sure that you're in full contact and that that energy is directed where you need it to be. Doing okay, or do you need a break?
I'm good.
Okay.
What's the downtime for these two treatments combined?
So the downtime is only a little bit prolonged because of the TCA. There will be scabs that are visible. And so with that, I would say at most it's 10 days for a more serious treatment of TCA. When it's mild to moderate like this, it should be about a week. If it was Fractora alone, you're looking at about 3 days. One more here. Good. Breathe.
Oh.
Yep, I know. It's worth it. So we just treated this cheek. Now we're going to move over to the other side. So go ahead and turn your head. I'll give you another minute to breathe. So I'm looking over the TCA. There's you have developed the frosting. And if you look really closely, I don't know if you'll see it on the telephone, but there's very small amounts of swelling just around the area that has frosted. And that's just a skin response. It'll go down shortly. You feel okay? Ready to keep going? Okay. So she'll be happy to know I do have her energy pretty nice and high. The higher the better. Of course, we'll lower it if it was extremely uncomfortable. However, the higher the energy with radio frequency, the better the result will be. And so it has its limitations, but only based on tolerance. You can treat very high in any skin type for a number of concerns, whether it's acne or fine lines and wrinkles or skin tightening. I'll give you a little second to breathe there. It benefits all of them. You can go really high in your settings for each. However, we are extra cautious to pre-treat darker skin tones with brightening agents to reduce any pigment production. Even though in the studies that have been documented with coated radiofrequency needling tips, there was not any incidence of hyperpigmentation. So even on the darkest skin types, you're getting a really nice improvement and a very high rate of safety. Almost done. I'll give you a
Would doing the
break.
Cosmetic before this treatment or before the TCA as well help prevent any
Post-hyperpigmentation?
Yes.
So Cosmetic, I have a couple names for Cosmetic, and it's my insurance policy, and it's that starting point of the race, that little checkered line. For patients who have a tendency to pigment, or even patients who just have a lot of pigment from acne scars, that reddish pinkish brown color, doing a Cosmetic beforehand is going to be very beneficial, and it will reduce the patient's risk of developing any of that PIH with any heat or trauma. Both of those are likely to cause, let me just do one more, likely to cause PIH. So when you pre-treat the skin with retinols and hydroquinones and a few different brightening acids, you eliminate that risk and you just have more freedom to treat at a more aggressive level. Did we numb your chin?
No.
Okay.
No.
How about around your nose?
They just left that one
Okay.
for this time because we did the TCA for that.
Okay, perfect. So turn your head a little bit. So there's tiny little bits of pinpoint bleeding. It means that we're reaching the papillary dermis. So we do get a little bit of bleeding, and she's just developed some really even erythema or redness in the area. If you look closely, there's tiny little circular areas of swelling. You can see a little bit more when you stretch the skin. That's just a little bit of response to the actual needle penetration and the energy we've delivered. So her skin is feeling, what, really warm, a little stingy right now?
Yeah.
Okay.
Cooled down really fast.
She'll cool down fast, but she'll cool down even faster because we use products specifically designed to hydrate, soothe, and reduce the temperature of the skin. By cooling the skin, we make her downtime a lot shorter and improves her healing. So we're going to put a few serums onto her skin, put on a nice brightening mask. She did awesome, and she'll enjoy the rest of it, which is like the ah moment.
Right.
All right, thanks for checking in, guys. That was TCA and Fractora.